The way we stand also impacts our pelvic health. And so you don't have to have a standing job because in life we do stand. We stand in lines, we stand in the kitchen. I'm going to share a few tips that you can do both for assessment and techniques that you can do to make it easier. So, the first thing we want to look at is our feet. So, consider your feet. Are they constantly out? Is one out and one pointed forward? Are you really out on the edges of your feet, or are you all the way back on your heels? Do you have a tendency to pop one hip or the other and often stand with that cocked like that? Next thing we want to look at are our knees. And so, are your knees constantly rotated inwards? Are they more bow-legged and kind of out? Is one doing one thing and the other doing another thing? Are they hyperextended? We want to think about what position our pelvis is in. So your key points that you want to think about are those pointy bones in the front of your pelvis. Next, your chest. Are you always noticing your chest sagging down, your shoulders rounding forward? Are you really arched up, popping out your chest? Is your chin jutted forward? Is your head cocked to one side or the other? From the side view, when we think about our posture, think about our pelvis. So find those pointy bones in front. A slight forward tilt or anterior tilt is neutral, but we don't want that to be excessive. So when those points are too far forward, you see your bottom kind of sticking out. This is when you'll see your knees really hyperextended versus more neutral. So look at your knees. Are they hyperextended and popping out your bottom, jutting out your abdomen and kind of dumping your pelvis forward? Are you somewhat forward, but then you lean back and you notice this kind of slouching and abdominal distension position? A lot of times like soreness in your lower back. Are you trying to engage your abs constantly or suck in because you don't like that pooch, but you're still stuck in this position? Is your chest really popped up and out this way to compensate? And then again, that head jutting. When we look at all of these pieces in our body, if we're in a nice neutral position, our knees should be unlocked, our center of mass should be over our base of support, so in between the feet. You can feel in your feet, are you kind of far back on your heels, but then you notice your pelvis is jutted forward and then your chest is dipped? If we are in a position where our feet, knees, hips, pelvis, chest, head are in an altered position, our body's trying to align us to gravity. We don't feel the impacts of gravity on a daily basis because we live in gravity, but our joints do because that's where it's holding us up. Proper joint stacking will help to improve our overall muscle function. So if you're constantly pulling in your abs or sucking in your abs because you don't like that pooch, it might be some simple posture considerations you can change to really make a difference. Or if you have chronic low back pain because you stand all the time, this is something that can really be helpful for you. If you're finding that you need to stand for any prolonged amount of time, so let's say you are prepping food in the kitchen, or you're standing around the house, or you're standing at work, even in the grocery store, you can find a stool or a ledge or something that you can rest your foot on, where you can put even weight still through both feet, but you just allow your pelvis to stay in a more neutral position. It's much harder to jut forward or even sink back when you have even feet and one leg is popped. And you can always switch legs as well. This is a great way to ease that lower back pain, keep your pelvis in a more neutral position. So from the side, if my body always wants to do this and I just rest my foot up on something, I've evened that out and it's much harder to stay in that anteriorly rotated position. I kind of now have to force myself into that position, whereas now I can just kind of rest there. So this is a really good way to ease that low back pain. And the signal for you might be that you're starting to get some tightness there. Maybe you're in the grocery store and you're waiting in a really long line. You can find a little ledge of something to just place your foot up top and take that pressure off and keep that pelvis more neutral. Additionally, when I'm locked in this position and I'm trying to engage my abs, it's really difficult and I'm going to lose that and kind of pooch back out. I also don't have a lot of mobility here. So if I try to move my pelvis in different ways, I'm not really able to. Whereas when I unlock my knees, now I have a lot more flexibility in my pelvis to go into different directions. If I use a little step or ledge, I can kind of relax that and unlock so my pelvis has some mobility in it. There's a few other little tips and tricks that I'll give to my patients just to experiment with and try to make those adjustments. So finding where the weight is in your feet. If you start with your feet, that's going to be the base that's contacting the ground. So you kind of have to start there just to feel out where you're at. So if you rock kind of back and forth on your feet after you best identify where your weight and your feet are, whether it's on the outer side, inner side, further back towards your heels, or on your toes, just rock and kind of feel the ground, and then just settle somewhere where you feel your weight is kind of dispersed throughout your feet. From here, notice if your knees are locked, unlock them, and you can either do a few things. You can either think about lifting the arches of your feet while keeping your feet still flat on the ground, so you're not going over too much, you're just kind of lifting and activating. And if you see where my knees are, you see there's a little rotation outwards because that's coming from my hips. If I do that, it's forcing my hip to come back a bit, and then my pelvis has to go back into that to fit into the hip socket, or it has to go ahead and allow where the hip joins to fit correctly. If our feet are flattened and rotated in, our knees are going to rotate in, that pulls our hips forward, and then that makes our pelvis go further forward. I'll demonstrate that here. If our feet are collapsing in, our knees are going to be rotated in, that's pulling our hips forward, and it's going to force our pelvis to also come forward so that the hip still fits nicely in that socket. If we think about just engaging our arches of our feet and lifting up, you get a rotation of the hip, and you get that nice posterior tilting of the pelvis automatically. You may even feel your abs kind of kick in without you having to engage them. Similarly, if we just think about our knees, our weight is evenly dispersed through our feet, making sure our arches aren't collapsing, but let's say your feet are neutral. You can think about just giving some gentle pressure and rotating your knees out, and that's going to provide that same impact to the pelvis and thus the abdomen.